everyone, happy Wednesday. I will be going live today with Lillian, who is the Executive Director and co-founder of HPV Cancer Alliance. So she'll be popping in here shortly. There she is. And we will be discussing HPV cancer and education and all of the different things this amazing alliance is doing to help educate people. And then I'll talk a little bit about pelvic health management as well, and we'll answer any questions that you all have. While we're waiting for her to come in, I just wanted to share that I was going through vaginal dilator research, and there's actually a brand new research paper that came out last month that goes over daily use of vaginal dilators during radiation treatment for anal cancer. And what they're finding is that it's sparing the anterior wall of the vaginal canal, so that there are better outcomes for those people after their radiation treatment, and they're having less side effects. Hi Lillian, I definitely see you. So you got a request to join me. Well, here she is.
Is that?
Hi, Lillian.
Hi. Am I good?
I can't see your beautiful face. I can see that you are in here. Is there something covering your camera by any chance?
Oh, no.
I see your
Wait.
computer now.
Oh, I know what I did.
Uh-oh.
How about now?
I can see your office
Oh,
and your computer,
okay.
but not quite you yet.
Okay. Sorry, guys. Okay. I'm trying to see how do I see
Oh,
me
there
now?
you are. Hi, Lillian.
Hi. I just turned the camera around, but I can't see anybody now. I don't know what I'm doing.
On the front of the face, if you hit it's like a little circle and it's got two arrows. It should make it so that you can see the front of your phone, and it'll flip it around.
Like that?
Yeah, there you are. Hi, welcome.
Okay, hi. Oh my God. I might know about HPV, but I really am not tech savvy at all.
You did a great job. And what we want to know is about the HPV, so don't you worry about the tech. Tech is haunted anyways. Tech is hard. That's our motto here at Intimate Rose. Technology is hard.
You're right.
What I was explaining to everyone is that you are the executive director and co-founder with Marsha Cross, who she's well known for her roles on Melrose Place, but also as the amazing work that you two are doing together to help educate on cancers related to HPV. And we are just so thankful to have you here today. So can you tell us about the Alliance and tell us about your work?
Yes. Thank you so much, Amanda. I'm so excited to be here and to know you and what you've gone through. You're also a warrior. And thank you for having me here. So basically, should I go into why I started the Alliance and all?
Sure, that would be amazing.
Okay. So about 6 years ago, I was diagnosed with an HPV related cancer, anal cancer. I know I said anal, but you know what? You know what? If we didn't have our anuses, as Marcia says, we'd be up Schitt's Creek. So we really need to honor those anuses. So anyway, so HPV causes 6 cancers, and everybody seems to know about cervical, and they know about basically cervical. Well, there's 5 other cancers, like there's head, neck, and throat, which is on the rise. And women get it too, but more men get it than women. There's, as I said, cervical, there's anal, there's vaginal, vulvar, and penile. So what happened to me was I knew that I had HPV in my 20s. I mean, when I was growing up, there was no vaccine. The vaccine came out in '06, the Gardasil vaccine, which prevents HPV cancer. So anyway, I knew I had HPV, and then when you find this out by a pap test from your gynecologist, and then you go back and you get something called a colposcopy, which is a more detailed invasive test where they're looking at your cells, and came back negative. So I guess the HPV wasn't showing. So you're good to go. You're good to go until you're not. So that was years ago. And every time I went to the gynecologist, they were like, you don't have HPV. Well, I have HPV, but it just didn't show at that appointment. It's a very sneaky virus that you get when you're younger, at the first sign of intimate contact. You don't even have to have sex, and then it's a sneaky virus. It burrows in your epidermis, stays there, and it comes out later in life if your immune system is compromised. Well, I had no idea my system was compromised. I was working out at the gym, doing my normal. So anyway, I started to experience some symptoms, which thank God I did, because sometimes there are no symptoms in the case of my partner, actress Marsha Cross. So my symptoms were blood and a lot of itching, and people think it's a hemorrhoid. When it presents, a lot of men and women think, oh, it's just a hemorrhoid, I'm good. But it just went on too long. And I remember when I was in one of my Pilates classes, and I was like, oh, I feel like I'm sitting on something. I went to my gynecologist, who I've seen for many years, and my gynecologist said, you're okay, you're fine. She actually did a rectal exam, and it's a digital anal rectal exam, and I'm going to probably shock all of you. When you go to your gynecologist, ladies, you should be getting the rectal exam, where the GYN puts their finger in your butt, feels around, not just goes in and out, but feels around for any lumps and bumps. Because you know what? The vagina and the butt are close together, and HPV can travel. So why can't you get it there? Anyway, by the way, this is the cancer that killed Farrah Fawcett. Remember Farrah from Charlie's Angels? So, but 12 years ago, they didn't talk about it because it's, such a crappy cancer. They all are, but this is like not a sexy one like breast cancer, if cancer could be sexy. So anyway, she said I was okay. And I said, I'm not okay. And I went to another doctor, my gastroenterologist, Dr. Carl McDougall, and he said to me, we're going to do the most embarrassing test ever. And he gave me he did the finger thing, but he did like a sigmoidoscopy. And when he was finished, he didn't look at me. And I said, something's wrong. And he said, you know what, tomorrow we have to get a sigmoidoscopy. I said, well, what's that? Well, a sigmoidoscopy is where it's not a colonoscopy. It's where they actually look at the anal canal. Because when you get a colonoscopy, they're not looking at the anal canal, because they're bypassing, the camera is bypassing the first few inches of the anal canal. So I get the test. He comes over to me after I'm done, and he said, oh, exactly this. It's not the best news. You have cancer. And I was like, what? Like that moment where you're like, what? And I said, what am I doing with this? And he's like, I don't know, but it's treatable. So I heard the word treatable. And when I heard that, that's where I stayed. I didn't stay with cancer. I just stayed with treatable. I'm going to do everything I need to do to get rid of this. It's treatable. And then I went to Sloan Kettering here in New York City, and I got treated, with the barrage of tests. I'd never been sick. I don't even get the flu. And I had all my friends come with me. I had a calendar, and each day a different friend would come with me. And I think I did that because I was like, what am I doing in this hospital with all these people that have cancer? And I think having my friends around, it distracted me and so on and so forth. So got through the treatment. It's pretty grueling at the end, because you're getting radiated. I took chemo pills, but in the end, oh, and I had to be on a fentanyl patch. That's how much pain I was in. But as I was going through this, I was thinking, like, all the time, like, I leaned in, because a lot of people are embarrassed and they don't want to talk about it. Actually, they're going to say they have stomach cancer or something like that. And I called it what it is, because I felt like I have a responsibility now to everybody. I felt like I learned, I have something, like I got this amazing dress on sale. I have to tell everybody about it. I have a responsibility to let people know that, you know what, this is happening. These cancers are happening, and they're happening to people in my age group, 50s, 60s, 70s. For some reason, women are getting anal cancer, more than men, and the men are getting the head, neck, and throat. But almost everybody is surprised when they're diagnosed, because, they're going along their life and then all of a sudden, oh, you have an HPV related cancer. And they think, oh, I haven't had sex in a long time, or I have only had one partner. It's not about that. You get it when you're younger, especially if you never got the vaccine, like we didn't at our age group. And also, it just takes one. It takes one. You're not doing anything wrong. You're just being normal, but it's a virus. For some people it clears, for some it doesn't. So I leaned in and I thought, I have to learn more about this. I started to like Google anal cancer. Who knew there was like this wonderful siblings, three siblings who created the Anal Cancer Foundation when their mother died of anal cancer. And by the way, their mom had HPV in her 20s, like me, and she had her cells burned off, ablated. And so she thought, I'm good to go. Yeah, she was good to go. But then all of a sudden, one day, she was stage 4 anal cancer, and she died, and she shouldn't have died. So I'm going to touch upon a few things. So I leaned in. I started, when I was done with my treatment, I started doing volunteer work for the Anal Cancer Foundation. I really just have this burning desire to get the word out. Like, hey, everybody, hey, people, you guys got to get educated and know that HPV is out there. We pretty much all have it. And, you're not doing anything wrong. And you just need to be aware, and you need to get screened and so on. So when I say screened, I mean, yes, you go for your yearly pap test, but make sure, and they're supposed to be doing this, the GYNs, I would make sure that you're getting the HPV test. It's called the co-test, which is more reliable than a pap. And if your doctor doesn't do a rectal exam, go to somebody else that does, because that's part of a pelvic exam. It's not a guideline, but they should be doing it. A good doctor will do it. So then after I started doing a lot of volunteer work, I decided. So then I saw that Marsha Cross, the actress, had anal cancer, and actually she put a post out saying, "Oh, I'm just recovering from cancer." And then the next day she put, "Oh yeah, it's anal cancer. I know, right?" So I said, "Oh, she's feeling this shame and so on. I'm going to get in touch with her." And I got in touch with her. I said, "Listen, I need you. We got to start something, and I really need you." And she thought about it, and she came back to me and she said, "Let's do it," because she has such a beautiful heart and soul, and she wants to help people like me, but she's a public figure. But she said, "You know what? I'm going to help." And she's just been unbelievable, incredible. She personally answers her Instagrams and social media. She wants to help people all the time, ready to fly across the country to be with people that, that are going through this, that are less fortunate. But what I want to say to you about Marsha, unlike me, she had no symptoms. Her GYN who was super astute, who's retired now, called her and said, "You are late for your yearly appointment. You need to come in and get your appointment." Now, all of us are late sometimes. We're like, we're fine, we're fine. No, go to your appointments. So she went in for the appointment, and the doctor said to her, I need you to go to the colorectal surgeon, right, or colorectal specialist right now. And Marsha was like, "What? I have to pick up my kids from basketball practice." And the doctor's like, "No, you got to go. Whatever it is, it's treatable." So there it was, stage 2 tumor, like me. All because her doctor went in with the rectal exam and found it. I had symptoms, and my doctor didn't find it, and she did a rectal. Marsha had no symptoms, and they found it. So this is very important. So hence Marsha and I and our partner Dan Lifton, friend and businessman of ours, created the HPV Cancers Alliance 4 years ago. We're only 4 years old, but yeah, we're pretty, mighty and vocal. And we're out there. I mean, we're educating, we're creating awareness. We do a lot of things in DC at Capitol Hill. So just as an example, we've gone to DC. Marsha's come, and we've met with a lot of legislators to talk about the Prevent HPV Cancers Act, that it should be an act, it should be the bill, it should become a bill, and it basically educates everyone about HPV and the fact that there is a vaccine that prevents cancer. It's the only vaccine that prevents cancer. I know that if there was a breast cancer prevent breast cancer vaccine, everybody'd get it. So we've gone to the Hill, and we've met with President Biden's moonshot team. They are appointed by President Biden, along with Jill, his wife, to they want to cut cancer by 50% in the next 30 years, 20 to 30 years, which is pretty big. So we meet with them. We're actually going there in 2 weeks to meet with Moonshot. We have a bunch of mother and daughter pairs, teenage daughters, and we're starting with women this year. Next year, we're going to do boys. It's a pilot program where we're going to go to DC, and we are going to have a training for the kids on how to advocate for younger kids who can't advocate for themselves, because you should be getting the vaccine at age 9 and 10. And they're going to get trained on that, and they're going to learn more about HPV and the cancers it causes, and they're going to go to the Moonshot people with us as well, and we're going to meet with legislators. So that's pretty exciting. We're doing that in 2 weeks. I want to say another thing, couple other things. So for all of you that are on this Instagram Live, and you may be in your 20s or 30s, tell your parents, make sure that your mom, unfortunately, there's no screening for men, which I'll get to in a second, but make sure your mom goes for those yearly exams, because for postmenopausal women, the guidelines are, you don't have to go to the gynecologist as often, which it's wrong. That's when they need to go, because that's when the cancers are coming. So they really need to go to their gynecologist yearly, get checked, and also get that digital rectal exam. That means with the finger. For men, there is no test, but I will say this. For men, if they ever feel anything in their head, neck, throat, tonsils, whatever it is, don't wait. I know a lot of men don't like to go to the doctor. They don't want to ask for directions or anything. Go to the doctor, get checked. And you know what? I don't know how everybody is, but in New York, we get second and third opinions. Just like if I would have listened to my GYN when she said I was okay, I wouldn't be here today. If Marsha would have didn't have that amazing GYN, she wouldn't be here today. So really, like, nobody should be dying of HPV, it's really BS. Nobody should die from it. So I also want to talk about one other thing, which is the shame factor. So a lot of people have shame about having HPV, and then if they end up with an how do you call it, with an HPV cancer, they're even more embarrassed. A lot of times they're saying, "Oh yeah, I have stomach cancer," or "Oh, I have this." No, they need to say what it is, because they also have a responsibility to mankind to get the word out there. Because if we don't talk about this, this is going to perpetuate. This is an easy one to eradicate. Let me tell you something. In Australia, they're on track to get rid of HPV, I believe by 2030, I think it is, because the vaccine is mandated. I'm not saying we need to mandate the vaccine. It's up to you and whoever, if you want to get the vaccine. I'm telling you that there's a vaccine that prevents HPV-related 6 cancers. You can do the research. So I know somebody who, this is what I wanted to talk to you about. So in the gay community, okay, gay, lesbian, LGBTQ, a lot of women, they don't think that they need to see the GYN because they're not having traditional sex. Not true. You have to go see the GYN. So make sure you do that. But what I want to tell you is, I had a friend, and she was very well known in the fitness industry, very well known, and she was a legend, okay, and people followed her. She had a huge tribe. She taught classes at Equinox, the gym in New York. She was unbelievable. Well, she had vaginal cancer, and she was gay. She was married, and she came from a family, I believe they were a religious family, and she did not, she didn't want to let anybody know. And I think, there's an issue with going to the doctor and how the doctors are and being embarrassed, and then all of this, all the shame. Anyway, she ended up dying, which is just awful. But, if you ever encounter a doctor that is dismissing you or making you feel shameful, or just go to somebody else. Don't take it. There's plenty of professional doctors that know that these HPV cancers exist and they're on the rise. And, you need to be with somebody that knows what they're doing and they're educated. I live in New York City, and I'm lucky because a lot of people, the doctors here, a lot of them know what's going on. Unfortunately, when I talk to people in very rural areas, they're not being treated the right way, mentally, emotionally, and even with the type of treatments. They don't know what they're doing. And then a lot of GYNs have to do cleanup, if that's even an option. So, I've had people say to me, yeah, I'm crying, saying, oh, I'm a gay man and I got anal cancer. I guess I'm being punished. That's terrible. You're not being punished. This is like, you're just living your life, and you're doing normal things, and it happens. It happens, So that's basically what I want to say. I'm 6 years out, and I'm doing great. And, I am getting the word out still about HPV. And want to know something? Like I said, I live in New York, and I did a man on the street interview a couple of weeks ago where I was like running around talking to people with a microphone, and they were running away from me. But I don't care. I was chasing them. And can you believe, because I can't, that I'm talking to women who've had kids, who've who are educated, whatever. And I'm like, do you know why you go for a pap test? And they're like, I don't know. And do you know what HPV is? Maybe out of 100 people that day that I met with, maybe 3 people knew what HPV was. Maybe 2 people knew why they go for a pap. I mean, come on. You gotta take care of yourself. And that's the other thing. You need to advocate for yourself, because nobody's going to do it. And if you don't come into those appointments equipped and knowing stuff, you no, you need to know. You need to you need to lean in. I know a lot of people that they think, oh, if I don't look, I'm okay. Why would you do that? There's prevention and there's also treatment. So don't you want to be around for your family? I'll never understand that. So, so that's basically what I want to say. Again, our organization is called HPV Cancers Alliance, and you can follow us on social media. And my name's Lillian Kreppel. And if you have any questions or you need to reach out, feel free to email us. And I do hope that I've, shed some light and some education and awareness on this awful, embarrassing, stigmatized virus. Oh, I was going to say one more thing. Okay, just one more thing. I just forgot. So, when you go to your gynecologist and they tell you you don't have HPV, it doesn't mean you don't have it, because it just might not be showing up at the time, meaning active. When I went to my gynecologist that time 6 years ago and I felt like something was wrong, I didn't have HPV vaginally, but I had a stage 2 tumor in my butt. So just keep getting checked once a year. And I would get, like I said, the rectal exam. And this is the other last thing. You know how many women have said to me, oh, I know my husband's cheating on me because I just found out I had HPV and I didn't have it before. So I know that he's cheating on me. No, you don't know that, because you already had it. You got it a long time ago. It just happened to show up. And that's what happened. It's not, I mean, if he's cheating on you and you could find out and prove it, okay, that's another story. But you having HPV suddenly does not prove anything, because you already had it. It's just not showing up. So that's my talk for today. Feel free to ask questions, whatever you'd like. And I'm going to turn it over to lovely Amanda.
Lillian, you're amazing.
You're amazing. Wait, I can't. Oh, now I got to turn the camera around. Okay, there we go. Okay. Here we go. Wait, I got to turn. Okay, there we go.
So one of the things that you brought up was the sibling group, and they are actually the ones that introduced me to you. That's how we met, is that I had been partnering with that group for the last several years here at Intimate Rose, and I believe that she introduced us to you, and the world just got better because now we have more education, and I love your work so hard to make sure that other people don't experience what you did, which I deeply respect. One of the things that I was saying before you hopped on, brand new paper just came out last month, and I think that you and I had discussed this about using a vaginal dilator during radiation for anal cancer.
Yes. I forgot to talk about that. How could I forget? Go ahead.
Do you want to share about that? Because it's been published.
Well, I don't want to interrupt you, but you can say, and then I'll tell them about my pelvic floor therapy.
Yes, absolutely. So this paper just discussed, this group has apparently been doing it for like 15 years now. They've published a bit, and they just published this paper about using vaginal dilator so inserted into the vagina during radiation treatment to the anus for anal cancer. And what they were finding is that it was preserving the front wall of the vagina, and that those patients were having better outcomes with less pain and better sexual function when they came out on the other end into survivorhood during intercourse. So I was really pleased to see that. So inside during radiation, and then for patients that are experiencing stenosis afterwards, rectal dilators can be a really helpful tool for resuming pain-free bowel movements and just reducing pain around the anus and that superficial part of the rectum that's been radiated and treated and possibly surgically treated as well. But yes, please talk to us about pelvic therapy.
Yeah, so it's interesting. So when I was treated at Sloan Kettering, Justine from the Anal Cancer Foundation came with me there when I was pretty much at the end, when I was done. And she said, "Oh, I'm so happy to know that you used the vaginal dilator during your treatment, because when my mom was being treated here 12 years ago, they didn't have that technology. So basically what it is when you're getting treated for anal cancer, God, this topic is so sexy. Anyway, when you're getting treated for anal cancer, you're like lying down on the table, you're, like kind of like a frog-like position, and then the radiation machine is going over and around you. I had a dilator inside my vagina and taped down to keep my organs intact, so that there's less damage to those areas. Okay, so I mean, after menopause things change, but imagine if you get radiation down there, it could really be bad, where you lose elasticity, it's painful, so on and so forth. So I used the dilator during treatment, and it was toward the end, it was really hard, because I'm burned, so you don't want to put anything in there. But thank God I used it, because I'm doing great now, and I do have a set of dilators that I'm supposed to be using a few times a week, because if you don't use it, you lose it. And so, meaning if you don't have sex and you're not active, things could change down there. It could be painful even to just get like a speculum in. So I do have these dilators, which I've been told by my female sexual health doctor at Sloan Kettering to use them, and they're super beneficial. What I want to say is it drives me insane when I hear from patients, because I do talk to patients a lot, and they're from another area, and they're like, dilators? No, my doctor didn't mention dilators. My doctor doesn't think I need dilators. Really? Why? Why wouldn't you be getting dilators to protect that area? Doesn't that make sense? I just, it really drives me insane that that some of the doctors are influencing how your life is going to be lived, because of their lack of knowledge. So the dilator, if you're having anal cancer treatment, is necessary to keep your organs intact. But after I was healing, I got a prescription from my hospital to get pelvic floor therapy. And I did it, and it helped a lot. And, I was working with a pelvic floor therapist, and it absolutely helped me a lot. And I million percent, condone this and think it's necessary. Unfortunately, I know people that didn't use dilators, and they cannot have sex. I mean, it's way too painful. So that's what I wanted to say.
Absolutely. And the good news is that there's some evidence that shows that if they start, they can make some gains. So it's, we can still improve the flexibility of some of that scar tissue even years out. But it's not as easy as when it's a little bit more fresh and early on in the treatment. And then of course, like you said, having it in place during treatment, because it holds space so that the radiation is not affecting that vaginal tissue and preserving it. I'm so glad that you got that. And I'm so glad you got pelvic therapy.
Yeah, yeah, for sure. Absolutely. Me too.
Amazing. Is there anything else that you would like people to know about you or the Alliance or your work?
Um, we have a bunch of programs that we do, and we base it around the calendar year. Like March 4th is HPV Awareness Day. Like, who knew there was such a day? I know we're working with a couple of partners, and we're going to be doing New York City Pride. We're going to have a table with another charity called Cheeky Charity, and they are all about colonoscopies and so on. The founder has Lynch syndrome. So we're going to be doing Pride, a couple of Pride events in New York City, and we're going to be doing something with Ralph Lauren at the company. Marsha Cross, me, my oncologist, and Steve Post, who works at Ralph Lauren and had anal cancer and has HIV. And we're going to be doing like a whole thing about shame and so on. And in the fall, we're going to be doing something called Emerging Science, which hopefully, Amanda, you'll be able to participate in, where we have educators and people who are, pioneers in their field who want to share their information and smarts. We're going to be doing a series with a whole bunch of different people like that. Yeah, so I mean, we're here and just listen, pay attention to yourself. You know your body more than anybody else. Go for those checkups. If you're in your 20s or early 30s, make sure your mom goes for her exams. Oh, you may be wondering, should I get the vaccine? Is it too late? I got the vaccine at age 53. They say you can get the vaccine. It says up to 45. You can get it till you're 100. The issue is that the issue is that your immune system is better when you're younger. So I did get the vaccine at 53 because I thought, since there's over 200 strains of HPV, maybe it'll protect me against the strains I don't have. So I don't know, but I had no issue with it. I have a lot of people who are divorced or widowed who are asking me, should I get the vaccine? I'm going into a new relationship. I mean, they probably already have HPV. Like, we all pretty much have it, or we're going to get it at one point in our lifetime. But I don't think it would be a bad thing, but you can talk to your doctor about it.
Really good point. Absolutely.
Thank you.
Wonderful. Well, I will definitely be there with the Emerging Science.
Yeah.
And we cannot wait to see what you get up to next. I'm so thankful for all the work and education that you do, and I'm so thankful for you sharing everything that you've been through.
I appreciate you. You're amazing. Thank you. Are there any questions? I can see the chat a little bit, but I'm not sure. Were there any questions I needed to answer, or?
I haven't seen any questions yet. A lot of people love you, a lot of support for you.
That's nice.
People talking about use of dilators after, and use of Vagifem pessaries. Yeah, every person's different, but it's not, I like to say it's not too late to start your dilator training at any point after radiation, and it might be valid going in now that the awareness is out there. If you are going in for radiation treatment, to ask your physician if they use the dilator during the radiation treatment, and if not, why.
Right.
And just be ready to really use those dilators afterwards, again, also in addition to help keep the flexibility and mobility, and also keep the brain in tune to something going in that's not threatening, so that the brain doesn't anticipate pain and start to develop coordination issues that can be undone. It's all treatable, but that are a problem.
Yeah, I mean, if your doctor's not doing it, insist, go get your own dilators and bring them in. I mean, I don't get these doctors, some of them, yeah, can't go there now.
You.
I can't even start with them.
Yeah.
I had a girl, then by the way, I said the HPV affects, women, men and women 50, 67. Sometimes there's outliers. And they're on this call. I have a few 30-year-olds in their 30s and 40s that have had HPV cancers. But I have somebody that I know here in New York, in the city, and she said she has high-risk HPV, and she went to see a gynecologist here in New York, and she said to him, I'm concerned about anal cancer because I'm bleeding a lot. And this dumb doctor said, well, no, you don't worry, because HPV, that's on the decline. I mean, I don't understand where these people got their licenses, but they shouldn't be practicing.
And that's why we got to self-advocate when you know something's not right, just like you did.
Yes, exactly.
Well, thank you so much, Lillian. Follow Lillian at HPV Cancer Alliance. And like she said, they are great at answering any questions. And this is going to be saved to both of our walls so that it will live on for continuing education for providers and for patients and for the people that love them. And thank you so much. I really appreciate you.
Thank you. You're terrific. Thank you so much. Thank you, Amanda. Now,
All
now
right.
I just X out, right?
Yep. I'll close us out. Have a great day.
Thank you. You too. Bye.
Bye.